Hello, good evening. Good evening. Good evening. Episode 16. Good evening, everybody. Yes, trying to set up everything now. Okay. Hello, everyone. Good evening. Okay, I'm live on Instagram, I'm live on Facebook, and I'm trying to set up everything. I Care Online episode 16. Wow, I can't imagine that we are doing 16 now. Okay. Hi everyone, good evening, good evening, good evening, and welcome to Eyecare Online. Sorry, I hope this is okay. Yes, I hope you can all see me and you can all hear me. I hope you can all hear me. Good evening, everybody. Good evening, good evening. Okay, first of all, for before we start, I want to say happy Father's Day to all the men in this group, both on Instagram and Facebook. Happy Father's Day to every one of you. We appreciate you. We love you. We appreciate you for all that you do. If you're already a father, we appreciate you. If you're an intending father, we still appreciate you ahead of time because we know that you're going to make a great dad. All right, because for you to actually take out time and invest in knowing more about your eye, about your vision, for you to make it intentional, make your health intentional or be intentional about your health, shows that you are going to really be take good care of yourself, because you can't really take good care of your family if you are not seeing very well. So vision is very important, sight is very important. I mean, nobody will want their child to be leading them, like you're blind or something, right? So being intentional about your health is a huge milestone, and I want to congratulate you that have been watching us, that have been following this group, that have been following this page. Week after week, you come, you learn, you ask your questions, you get engaged. All right, so I want to say happy Father's Day to every man out there, and I want to say thank you for always being here. All right, so my name is Dr. Doris-Optometrist. I am an optometrist, and then my passion is actually eye health. I'm an eye health advocate. I talk about eye health. I share information, tips, strategies that you can actually use to maintain and enjoy your own eye health. And then for those that ask me whether I don't wear glasses, yes, I do wear glasses, but unfortunately or fortunately, whichever one, I don't wear my glasses live because of the ring light. It kind of show the reflection that some of my friends online don't like. So I have astigmatism, which is one of the refractive errors. So I struggle with seeing things clear at far, but I am very okay when I am within my house or with vision that anything close to me. So yes, I do wear glasses. All right. So if you are just following the group or you're just meeting the Facebook live for the first time, I come live every Monday by 9 p.m. West African time to share on to mostly answer questions that people sent ahead of time, or share on a particular topic that people have been asking questions on. So if you are joining, I would like you to kind of say hello, let me know where you're watching from. If you have questions tonight to celebrate the men, we're taking questions from the men. Okay, questions from the men. That does not mean that if you have an important question that is urgent that you can't send it, you can still send it, but I'm making men a priority tonight. So men, if you have a question, I have about 1, 2, 3, 4. I have 4 questions from men tonight I'm going to be answering. So if you have a question, please kindly drop it right now in the comments, and I'll do my best to answer it. Okay, so let's I try to keep this within 30 minutes maximum, so let's just start. Okay, so the first question is I'm taking from Abdullahi. Abdullahi actually sent this question like a couple of weeks ago, and somehow I keep missing it. When you have lots of questions from different people, sometimes a question can get lost, and all that. So Abdullahi, I'm so sorry. If not that you mentioned that you've been sending your question, I'm sorry for taking time. So Abdullahi said he experiences things moving in his eye like insects or dirt. And when I read the question again that he posted, Hi, Adi. So watching from Lagos. Thank you so much for joining. Thank you for watching. So when I read the question again, I remembered that we took time to kind of do to and fro, trying to understand exactly what he meant. Because initially I misunderstood him and I talked about something else. But when he now explained that it's like he feels that something moving in his vision in, I now had to understand that what he's talking about is what we call floaters. Okay, floaters are when you feel things like dust or insects, like even when you close your eye and move your eye, in any direction it goes with it. It can move in jelly like, it can move like insects flying. Patient describe it in so many ways. Some say it's like dirt, some say it's like insects, some say it's like cobwebs, and some of them will be like that. They try to remove it, they keep trying to clear the cobwebs until they find out that it's not physical, that it's within their eye. So we call it floaters. Now these floaters are actually they are debris, right, from what, or particles from the vitreous. The vitreous is the inside of your eye, the eyeball, the inside. There is this jelly like fluid that is inside, and then sometimes this jelly like fluid, I'm trying to find the right word to use, kind of sheds, right? I'm trying to find the right word to use to explain it. So I think I can say something like, how snake sheds its skin, something like that. So it's kind of it's particle from the vitreous. Okay, on its own it's harmless. When you are noticing that it's mostly age related, we see this mostly among middle age, older people, right? So when it's on its own, it's actually harmless, nothing wrong with it, it's fine. But we get concerned when the patient starts seeing it more and more and more. All right, so let me take it again. When you are seeing it once in a while, it just comes, it just goes, right? We don't have an issue with that. Okay, we actually tell you to either ignore it, or just to let it be. With time you get used to it. But when you keep seeing these floaters keep increasing in size or in number, then we get concerned. People who are also short-sighted can actually experience these floaters. People that have degenerations in their eye can actually experience these floaters. So basically, if the floaters in the eye are not much, they are just small and all that, we kind of tell you to either ignore it, or with time you kind of get used to it, because it's like part of aging, right? But when it becomes more, we get concerned. And even when we get concerned, there isn't actual treatment. Okay, the first of all, what we do is we run a test. We do a dilated test. We put an eye drop in your eye to open up your eye so that we can see the back of the eye. Because when it becomes more and more, we try to find out the exact cause. People that are diabetic can also experience this. So if it is due to diabetic retinopathy, like due to diabetes, we try to manage the diabetes, the sugar. If it is due to like I said, people that are short-sighted, highly myopic, we try to handle that. We try to handle the cause of that floaters. Floaters on its own does not actually have treatment. What the only treatment they can actually do is to do surgery. The surgery is to remove the entire vitreous, and then that's the entire chamber, and they will now put artificial fluid to keep the eye in shape. That's number one, which I don't really recommend here in Nigeria. Okay, and then the second kind of surgery is the laser. They use the laser to target those floaters and break them apart. Now the challenge with all this, after the surgery, the likelihood of the floaters to come back is still high. Do you understand? So for us, what we actually do is we try to manage it for you, or manage it with you, the patient. If it is due to age, we'll explain to you that it's part of the aging process. If it is due to diabetic retinopathy, that diabetes of the eye, or is due to refraction, as in you're short-sighted, we kind of tell you what it is and try to handle it. But floaters on its own, there is actually no really treatment for that. So basically, Ablahi, that is the challenge. Okay, so let me see. Joycey. That sounds like a female name. I need a lens. Okay, we can talk about that. Send me a DM and then we'll talk. Okay, so Abdahi, that is it. So if you are experiencing floaters, I suggest you go to an eye clinic. They are going to run what is called a dilated exam to look at the back of your eye, especially if the floaters are increasing. Do you understand? And then with that, they'll be able to tell you what is likely causing these floaters. If it has to do with age, then you have to kind of know that this is something that has to do, that comes with age. And you know, and then again, what can actually help? Yes, sorry, I forgot to mention this. What can actually help is antioxidants can actually help. Eat green vegetables and fruit. Your diet is like aging gracefully, right? Like I'm hoping that has to do with age. Okay, so it can actually help, yes. But basically, surgery for to remove the vitreous and then to target the floaters is something that you really have to be very careful if you're going to do that. Okay, so Akim sent a question. Akim said, I'm watching live from Victoria Island. Hi, good evening. My question, if visual acuity is a medical test to determine how well one can see, how often should the eyes be tested for visual acuity? Okay, now let me say this. I'm going to say this in let me start by visual acuity is a standard test, right? But you don't really have to go to the clinic to test your visual acuity. Let me take it again. Example, like during the lockdown, most of us were on lockdown, right? And we don't have access to clinics. Does not mean that you cannot check your visual acuity. Now, what I tell my patients, especially those that can't easily come out every time, or yes, it's this. Come out of your house, find the farthest tree or the farthest house that has a window. There has to be a detail to that particular object. I prefer using trees, palm trees that has like a particular number of branches, for example 6 branches, right? So find that farthest tree, get 2 or 3 people in that your compound or in your house that will stand in the same spot with you, and close each eye and then use that palm tree as a target. Now, for example, if the palm tree has about 6 branches, okay, and then the 3 of you, different ages, but similar and all that, stand and look at the palm tree, and the 3 of you sees the 6 branches. Close one eye, do that. Close the other eye and do that. Okay, you can do this every month. You can do this every 2 months. You can do this every week. Now, how often you do it depends on a couple of factors. Number one, do you have any systemic problem? Are you hypertensive, diabetic, and anything that can possibly affect your vision? Number two, do you have any family history of any systemic problem, including eye problem, like your parents, grandparents, uncle? Are they diabetic, hypertensive? Do they have glaucoma or cataract, any of these stuff in your family? So any of these two are factors that determine how often you can check your visual acuity. Now the thing is, if you have family history of this eye problem, then of course you have to check your visual acuity as more often than someone that does not have any family history of eye problem nor has any systemic issue. Okay, so how often you check your visual acuity depends on some of these factors. Then again, your weight. Have you been diagnosed of are you overweight? Have you been diagnosed of any refractive error before? Now, I've had patients that don't see with one eye and they never knew about it. Okay, so to them, because they wake up, they can see, they move around, they never actually take time to do all this. And then secondly, if you wake up one morning and realize that the 6 branches on a palm tree that you were seeing before suddenly have turned to 4, something for you to be concerned about. Okay, so basically you can check your visual acuity as often, and then you don't have to get to the clinic to actually do that. So if you wake up and find out that the vision is not as clear or as sharp as it used to be, then get to the clinic immediately. So before I take your second question, let me take a question from here. Okay, so Wolumaiti said, I'm having eye itching since 3 days ago. Now my right side is not as clear as my left eye. Okay, now I've talked a lot about itching. Okay, many times the reason why we have itching can be due to an allergy, can be due to refractive error. And then so if it is due to an allergy and you're seriously scratching your eye, no matter how, if you scratch it to a point, you can actually wound yourself. Okay, there are some of us that when they are scratching like this, according to the patient, it was sweating me and I kept scratching, and we forget that the eye is a very sensitive part of our body. if you keep scratching, you're going to bruise yourself, and when you bruise yourself, that is a huge problem. That's a huge issue. That's why we try as much as possible to discourage people from scratching. If you are experiencing eye itching, it's best for you to identify what is the cause. If it is due to an allergy, then get the right medication and stop the allergy. Okay, if it is due to refractive error, then get the right glasses. Whichever one be the case, if you keep scratching your eye, you are definitely going to injure yourself. So one of my tips, if you've been scratching your eye for the past 3 days, I suggest you go to the clinic, especially if your vision is now affected. Usually allergy, minor itching does not affect vision, but for you to start having vision issue, it's highly possible that it might have compromised the cornea, that's the surface of your eye. So get to the clinic, please. All right. Okay, let me take another question from Akim. Akim said, my colleague sometimes feels as if there is sand in his eye. What could this mean, and what should he do about it? Okay, first, Akim, I wish your colleague is here. I would ask me a couple of questions, but there are different things that can cause one to feel as if there is sand in his eye. It can be due to dry eyes. It can be due to astigmatism, refractive error, but let's focus on dry eye because that is the one that is most common now. And the dry eye can also actually be due to prolonged exposure to phone. All right, dry eye is one of the computer vision syndrome, digital eye strain that we experience because we keep staring at the screen, which is why I promote the 20-20-20 rule as often as possible. For every 20 minutes you spend on your phone, look 20 feet away for at least 20 seconds and blink. Sometimes we get so engrossed in what we are watching on our phone or what we are doing on our smart device that we forget to blink. And then because you don't want to miss the action in the movie, you are looking and looking and looking. By the time that action passes and you now blink, you feel this sharp pepperish sensation. And why is that? Because the cornea, the outer part of the eye, is dry. The blinking keeps it moist. So when it's dry for some seconds and you finally blink, the lid sticks to the cornea. Like when you close, it sticks. When you open, you feel as if there is sand. You feel this pepperish sensation. So many of us are experiencing dry eyes because of prolonged exposure to phone. So basically, like I said, I'm just assuming here because your friend is not here for me to actually know exactly. So if your friend is someone that works a lot on a system, then suggest to him that he should get a blue cut lens. A blue cut lens will definitely help him to protect his eyes, okay, against the rays of the phone or of the phone. I did a video about this on Instagram, and I think I'm posting an article on this tomorrow on Facebook, so you're going to see that article tomorrow and then know what to do about digital eye strain. But that is my highest guess right now because I'm trying to use the age bracket and to answer that. My location in Lagos, I am not in Lagos, Hakim. I'm actually in Akwa Ibom. I'm in New York, but I have amazing colleagues in Lagos I can refer you to if you really want to see any of us. You can send me a direct message and we will talk about that. Okay, so I think we can move on now. I'm seeing all of you. Thank you so much for joining. Nosa, Nora, Samsung, Annie, and Medobi. Okay, Debbie, hi, I'm seeing all of you guys on Instagram. So let's move on to Amy. Amy said, I'm using glasses which was issued to me by a clinic. Please, I don't like using glasses. I need a solution. Okay, yeah, this is something I experience like literally every day in my life now because I see patients that when they come to me and they sit down in the patient seat, and before I could say Jack Robinson, doctor, I don't want to wear glasses. Like, there. And somehow to me it's like they feel that when they say, doctor, I don't want to wear glasses, it magically changes everything, right? When it doesn't. And my response to them is usually this: the fact that you come to me is for me to give you the best solution to your problem. Does not mean you must like the solution. It's my job to offer the best solution at this time. With the technology available and all that, doesn't mean that you have to like it. Then it is your decision to either follow my advice or not. So many times people just don't want to wear glasses, but glasses is the best solution for them available at that time. If you have a refractive error and you are issued a pair of glasses, depending on the refractive error, thank God that there is even contact lens, there's even bifocal contact lens now, although I've not seen it in Nigeria yet. But you know, my friends outside the country are recommending it, they are using it. So even if your glasses is for both sight and reading and you don't want to get glasses, then get a contact lens. That's another alternative. Okay, and if you don't want to try contact lens, because there's some of us that have this belief that contact lens is not good, is this, is that. Yeah, contact lens may not be as great as spectacles to some people, but to some people they love contact lens. Another solution or suggestion is for you to do surgery, and for me, I don't really recommend that surgery, especially in this part of the world. The reason is that, I mean, if you can see, the only challenge is just to wear glasses, and then you go for surgery and an incident or complication arises and you lose your vision. Which one is better? Which is worse? So let's think about that. So for me, surgery should always be the last resort. Okay, it should always be the last resort. Try non-medical aids. So if you don't like glasses, but it's giving you the vision that you need, it's giving you the vision that you want, that you desire, then please. Many of us, we don't do, not everything that we do that we really like, but it's a necessity for your health. So you have the glasses, you have the contact lens, you have the surgery. So whichever one that works for you, you can send me a DM and I can recommend which one or where to go for, you know, for any one of them. Okay, so I'm getting to the last question for tonight. Like, the men didn't really have much questions tonight. I wonder what happened. Okay, so Linus Udochoka said, Doc, please, I'm having Apollo, though I'm applying eye drops and taking some drugs, but I am advised to apply my urine for fast relief. Is it medically correct? Now, when I saw that question, first of all, I don't know where to pick offense with. Is it the fact that you're asking if applying urine is medically correct, or the fact that you're asking me? One of them kind of, I was unhappy to read that. Number one, there is no clinic, like, first of all, where you diagnose that what you have is Apollo. That's number one. Were you diagnosed by a clinic or by a doctor that what you have is Apollo, or were you diagnosed by your friends, your neighbors, and other well-meaning friends? Because I have seen people that has allergic conjunctivitis, as itching, and their friends told them that they have glaucoma. I've seen people that actually have glaucoma and the friends tell them that they is from the village or something. You know, people kind of misdiagnose, and if you keep listening to people's diagnosis, you end up not having the right, of course, definitely you can't have the right diagnosis. And without the right diagnosis, you can't get the right treatment. And without the right treatment, you can't get the relief that you need. Apollo simply means bacterial conjunctivitis, basically. And what that means is inflammation of the outer part of the eye. Okay, so we experience, part of the symptoms is the sandy sensation, the mucus discharge, those whitish discharge, the redness, the feeling as if, yeah, there is sand in our eye and all that. And on its own, depending on the degree of this of the infection, it can actually resolve without doing anything. But like I said, depending on the degree, we tend to give antibiotics and some other medication, and most times with the right medication, within 2 to 3 days you get instant relief. Within 2 to 3 days with the right medication. And when you have that kind of infection, they don't pack too many drugs, or because we all know that bacteria most times run its course. So what we're actually giving you is kind of to help you with the symptoms. And then you are also advised that, most importantly, what will actually play a role in getting it to stop faster is the hygiene. I've seen many people that when they have Apollo, they use their handkerchief because of the tears. They'll be cleaning the tears with their handkerchief. We don't do that. In my clinic, I have a whole section of pocket tissue. Pocket, not the normal toilet roll or serviette. Pocket tissue, because pocket tissue does not have particles, a lot of particles. It doesn't even have any, right? So we advise that you don't use your handkerchief to clean. Instead, use a pocket tissue, you clean and you discard, because when it comes to that, hygiene is very important. If you keep using your handkerchief, you keep reintroducing the bacteria over and over again. And when you do that, you find out that the Apollo will last longer or will stay longer. So basically, if you have been diagnosed of Apollo, they will actually give you either a strong antibiotics and then what is called a non-steroidal anti-inflammatory to help you with the symptoms. All right, and within 2 to 3 days, you're going to start feeling better. The bacterial conjunctivitis will run its course eventually, and then it will stop. Do not instill your urine. Your urine can actually have, it may have some infection that you don't know about. And by the time you instill your urine into your eye with whatever infection that you already have in your system, you are now introducing another form of infection into that eye. Please, it is not medically correct, it is not psychologically correct that you're going to instill urine into your eye for something as simple as Apollo. I've heard different things. I've even seen someone that went and instilled the water of a scent leaf, thereby burning the black part of her eye. And right now she's looking for money. Hi church, good evening. Now she's looking for over 1 point something million to go and do corneal transfer. So please, as we listen to friends and the family and well-meaning people, let us be very mindful that the eye eventually is ours. All right, so please, it is not medically correct to instill urine. Okay, let me see. I think I have one more question. Okay, I came in follow up with the guy that has sand in his eye, feel as if there's sand in his eye. He told me he started when he was cajoled by one man who was promoting herbal remedies to apply urine whenever he suffers itching. He actually applied urine. Like, why? What is it with this urine? Oh my God. What is it with urine, guys? Do we listen to everyone that says everything about our body? Like, for goodness sake, the eye is the eye. There is no spare. There is no eye transplant anywhere. There is no, you can even get an arm prosthesis and still use your arm, but you can't do that with the eyes. What is it? Okay, what if he has gonorrhea in his system? What if? And then he instills it in his eye. What if? And now he's feeling as if there is sand in his eye. If you have itching, just find out what is the reason why I'm having the itching. Is it due to allergy? If it's due to allergy, what am I allergic to? I did a video on this on YouTube. You can see it about itching, because if you understand what and what you are allergic to, like I know what and what I'm allergic to, so I avoid them. So I hardly have itching. If you are an astigmat, if you suffer from astigmatism, part of the symptom is also itching. You always feel as if one eye, you are always itching. And the truth is, the more we are exposed to phones and smart devices and all that, we're going to be having some weird feelings in our eyes. Some of us have developed eye problem because of prolonged exposure to phones. So when that happens, what you need to do is to find a solution, a way to protect your eye. Get a blue cut lens, which is not so expensive. Reduce your screen time as much as possible. Normally, people spend, before it used to be 6 hours a day, but now they have moved it to 10 hours a day. That is what human beings spend on the system, 10 hours. So reduce your screen time, be deliberate about it, increase your outdoor time. And some of the issues that we are having, this struggling with, will end. But please, can we just stop with the urine? Can we just stop, please? Alright, even if you can't get me on phone, you can always drop your message inbox. I make sure I respond to every message within 4 to 5 hours. I do that. I respond. I'm busy at the clinic, but I still make sure I come to my inbox. I may not respond to comments, but inbox, I definitely always try to respond. Avoid putting urine into your eye. I don't know how else to say. I think that's what I'm going to be talking about. I think I'm going to put it as a short status update. Stop putting urine into your eye. Okay? Don't wash your face with urine. Don't put urine in your eye. Don't do any of those stuffs. Don't even test it for sugar. Don't just do it. Urine is urine. Alright? Akim, so let your friend chat me up, okay, and then let me see. And since you're in Lagos, let me know the exact place in Lagos, and then I'll be able to link you up to. I have a couple of colleagues, you know, that are in Lagos, and I'll be able to get one closest to you. Hi Dim, thank you so much watching from Imo State. Thank you. So that is it. Then I have a question from Instagram. Someone sent me a message. Okay, Church is saying, I hope I'm not late. Ah, well, I think you missed the better half of the of the whole thing, but so you can always watch a replay. Someone asked me earlier that how come I'm this consistent. I know it doesn't have anything to do with the eye, but it's a question that came to my Instagram story. Well, I'm consistent because I'm passionate about this. I'm passionate about your vision. I'm passionate about reducing the rate of avoidable blindness, because I see many people. And what actually inspired me to do all this is about a young guy here in Akwa Ibom. His name is John. John was diagnosed of having an end-stage glaucoma at the age of 26, and he was in third year in the University of Uyo, I think, one of the schools. Yes, he was diagnosed of end stage. End stage means he had lost about 90% of his vision at the age of 26, and the problem was that he never knew he had an eye problem. Sorry about that, I had a call coming in. Okay, so John never knew he had an eye problem at all. No one ever told him. No one ever, you know, spoke to him. He never went to the clinic because he felt that he's young. So usually, in my early days in practice, I used to see eye problem for things that, you know, you wait until your 50s, you're in your 60s for you to start, you know. But I realized that if someone as young as John, who is 26 and almost blind, actually he's legally blind right now, you know, if someone had told him earlier about the importance of early detection, that it might have probably saved his sight. So that is what inspires all the programs I do, both online, on the radio, talking to everyone regardless of your age. If you have family history of eye problem, and even if you don't, as long as you're always on your phone, on your devices, and as long as, you know, you can, just go for a vision screening. Let's start with that. Let them even screen you. Now, you're not going for the main thing, like, you know, because there's a difference between vision screening and then eye examination. Most of the things we do in outreaches are screening. They are screening. Now, let them even screen and tell you, oh, okay, your vision is fine, all right? And then at least once every year, as you schedule for medical check, please do that. In our own case, unlike medical check, you may wait until you are sick to go for medical check, malaria, typhoid. But in our own case, sometimes by the time you start feeling as if there's something wrong, it's too late. Okay, so once a year, go for medical for eye examination. Let a doctor actually examine, not the one who do at the markets, the roadside. Let them actually examine the back of your eye. Examine, because we can detect ahead of time if you are going to have issues and help you protect it. So what is helping me to be consistent is whenever I feel like giving up or I feel like getting tired, I remember a John out there who might probably need this information. I'm located in Akwa Ibom. Most of you are not even in Akwa Ibom, so but I can link you up to people that I trust. I have colleagues in Imo State. I have in Lagos. I have in different parts of Nigeria. I even have in Canada, in UK. So wherever you are, location is not a barrier. All you have to do is reach out to me, tell me your location, and even if I don't have my classmates there, I find colleagues that are not from my class but a different class and reach out to them and tell them to please attend to this, my friend from Facebook. So basically, I hope that answers the question why I've been consistent. Okay, hi, Kaitizika, thank you for watching. Engineer Amos Oka for watching from Lagos. I think I developed cataract. What could be the cause and what remedy can be used to cure it? Okay, so this will be my last question tonight. Now, cataract is when the I don't know if you can see this. My eye, you can see where the ring light is reflecting. That part is white, like it's looking like this, right? That is cataract. Many people what they say is that their vision is like harmattan, it's like dusty. That's the first sign. That's the most common sign patients, you know, talk about. Okay, so basically when you have cataract, the best form of treatment or cure is surgery. People don't like hearing that. They want you to tell them to use eye drop, but the truth is eye drop will not do anything. It won't. Okay, some people will tell you to buy eye drop that is going to melt it. Now remember what I just said, cataract is inside. So for the drop to melt the cataract, it has to melt your cornea to get to the inside. So basically, right now, as today, there is no eye drop that will take care of cataract. What you need to do is to remove it. And cataract surgery is, if you are doing laser, which is my recommendation, is a less than 5 minutes, 5-10 minutes, you're done. They remove the opacified, the white lens, and then they put a new lens, and you see very well. If you're someone that used to have refractive error, there's a kind of lens they're going to put, you don't even need glasses to see again. Okay, so the remedy, the solution, the treatment right now is surgery and engineer Amos. So please be wary of people that will tell you to come, let's do this, let's do that, so that you don't end up causing more problem or causing more harm. And then in Lagos, I have a good clinic that can actually do the laser. Like, that's where I refer my patients from Akwa Ibom to Lagos that want to do laser, because with laser surgery there is similar, almost no complication, unlike manual surgery. So if you're interested, I can actually link you up with my contact there in Lagos VI, yes, and then they can help you get the surgery done within. You can go in and go out that same day. It's that simple. Let me use the word so that it's that easy. All right, so that is it. So, but I hope you have been well diagnosed of that. Okay, so it's very important. All right, so thank you so much everyone for tuning in tonight. I appreciate each and every one of you, and I hope we got value tonight. Remember, my DM is open. Even if I don't respond immediately, I will respond within 4 to 5 hours. That's a promise. So let's keep taking good care of our eyes. Tonight is for the men, so from next week we are back to everyone. And don't worry, women, ladies, I will get across to you guys on a special night for you. My name is Dr. Doris-Optometrist, and I want to say have a good night rest. So let's send Instagram first and then Facebook.